Why do some people with type 1 diabetes develop kidney failure, while others with the same condition for decades do not? I learned something very important recently from Professor Group when he presented findings from a Finnish study uniquely positioned to understand health, genetics and environment. This question has been studied very carefully in Finland, home to one of the largest and most detailed type 1 diabetes databases in the world. And what they've found is both confronting and incredibly empowering, because it tells us something very important. Your diagnosis may be fixed, but your trajectory is not. The study I'm referring to is the FinnDiane Study. This is a large, long-term study following people with type 1 diabetes over many years, looking at kidney disease, cardiovascular outcomes, and overall metabolic health. Now, traditionally, we've thought about type 1 diabetes quite simply as the body doesn't produce insulin. So you replace it, and if control isn't perfect, complications develop over the time. But the Finnish data challenges that in a very important way. What they observed is this: some people develop kidney disease, others don't, despite similar duration of diabetes. So the question becomes, what's the difference? And the answer is not just glucose, it's metabolism. There's a concept called double diabetes, and it's one of the most important ideas to understand if you have type 1 diabetes. Let me explain it simply. In type 1 diabetes, the body doesn't produce insulin. But in what we now call double diabetes, the body also becomes resistant to that insulin. So now you have these two problems: not enough insulin, and the insulin you give doesn't work as effectively. Think of insulin as a key and your cells as locks. In type 1 diabetes, there are no keys. In insulin resistance, the locks become stiff and rusty. In double diabetes, you're injecting more and more keys into locks that don't open properly. And this puts enormous strain on the system. And this matters because the Finnish data shows that this metabolic state is strongly linked to kidney disease, cardiovascular disease, and long-term complications. And even in people who are not overweight by traditional definitions, this happens. So, type 1 diabetes is no longer just about insulin. It's about metabolic health. Now, here's the most important part. This is the part I really want you to understand. This component, the insulin resistance, the metabolic strain, is not fixed. This is the part that can change. And I want to be very clear here. We are not talking about reversing type 1 diabetes. That requires insulin always. But we are talking about improving how your body responds to insulin, how much insulin you need, and how much stress is placed on your blood vessels, kidneys, and heart. That is modifiable. Let's bring this down to what actually matters day to day. There are 5 key areas that come out of this research. 1, body composition matters more than weight alone. It's not just about weight, it's about where your fat is stored. Visceral fat around the organs drives insulin resistance. So even small reductions here can improve metabolic health. 2, muscle is metabolic medicine. Muscle helps clear glucose from the bloodstream. The more muscle you have and the more you use it, the more sensitive your body becomes to insulin. I often say to my patients, muscle acts like a glucose sponge. 3, food quality matters. If your body is a high-performance engine, you cannot expect it to run well on ultra-processed, low-quality fuel. The more processed the food, the more metabolic stress it creates. It is not okay. 4, it's not just about HbA1c either. This is our measure for average glucose levels. It's also about the variability and overall glucose levels. Spikes in glucose matter. Those rapid rises and falls create oxidative stress, vascular injury. So smoother control is just as important as average control. And 5, blood pressure and lipid levels are critical. This is something the Finnish data shows very clearly. Even modest elevations in blood pressure, triglycerides, or low HDL, the good cholesterol, significantly increase risk of kidney and heart disease. And these are not secondary issues, they are central. So what are we really looking at here is 2 different pathways. One pathway, increasing insulin resistance, higher insulin doses, rising metabolic stress, complications over time. The other, improved sensitivity, lower metabolic strain, better long-term outcomes, same diagnosis, very different trajectory. So, what we can learn from the Finnish data from the FinnDiane study is this. Complications are not inevitable. Metabolic health matters, even in type 1 diabetes, and there is a part of this disease that you can influence. So I'll leave you with this. Your diagnosis might be fixed, but your trajectory is not.